So I'm really excited about our next session, having recently gone through my daughter's annual IPP with this new IPP form. Future planning and IPPs are always near and dear to the heart of regional center families. So joining us today is Ernie Cruz, Deputy Director of Community Services for the California Department of Developmental Services. Please join us on camera. Ernie, take it away.
Hi, thanks, Alyssa, and thank you for the opportunity to present today. Um, as Alyssa mentioned, my name is Ernie Cruz. I'm the Deputy Director in the Community Services Division at the department. Again, want to thank you for inviting me here today and the opportunity to share with you about the new Individual Program Plan, or IPP. This has been a project over the last couple of years, and we're really excited to have this new format launch as of January 1st, 2025. We have this PowerPoint slide, and I'll go through those. And as I'm going through, I will add some links in the chat as far as resources and other information. So if we can go to the next slide. For today's presentation, it will consist of the agenda items that you see on the screen. I want to go over the changes to the IPP, address the new format, and provide more context or information about the different parts of the IPP. I will also go over the different sections of what is a guide that was developed for individuals and families called Your Plan. This is a guide that the department put together and developed for individuals and families of all ages to help prepare for the IPP meeting. I'll review some resources that are available to you on our website before ending with some closing comments and any questions. So if we can go to the next slide. Oops, let me see if we can. There we go. All right, so we'll start with providing an overview. Next slide. So with the new IPP, you can expect some parts to be different than before. In putting together the standardized IPP, which originally the idea to standardize the IPP, it originated as a performance measure in the Regional Center Performance Measures Work Group. This is a work group of a variety of members, which include individuals, families, advocates, looking at regional center performance. And one of the things that group really emphasized was wanting an IPP that was person-centered and offered more flexibility in what an individual includes in their plan. So this included, focusing on strengths and linking to personal preferences and linking personal preferences to goals and outcomes. Additionally, this required a statewide implementation so that all regional centers are using the same plan. So it was consistent and standardized across the 21 regional centers. And there are areas and prompts in the IPP that are new. As part of this process, over the years, over the last 5 to 10 years, there have been investments made on increasing the knowledge base related to person-centered thinking and applying person-centered practices to supporting individuals served. This has now been applied to the development of the standardized person-centered IPP. Despite the changes, the principles and requirements of the IPP have not changed. The statutes and requirements of the IPP remain the same. The regional center's role in the IPP and the assessment of needs and services, and the documentation that is needed for information sharing. Next slide. In this section, I'm going to go over a quick review of person-centered planning and how it applies to gathering and documenting information in the new IPP using person-centered skills. The expectation is that both the process of developing the IPP and the contents of the IPP are driven using person-centered tools and skills. So what is person-centered planning? It's an approach that regional centers the approach centers on the individual to drive the decision-making process for the things that impact their life. It's a framework of planning for services and supports that is dynamic and individualized and is used to help people plan for their future and achieve their personal goals. It emphasizes people's unique preferences, strengths, skills, and aspirations. There are 7 key principles of person-centered planning. You can see here on the screen. That includes that it's individualized, that it's respectful, that it's collaborative, self-directed, has a whole person approach, is flexible and evolving, and is outcome oriented. These principles are important and must be the foundation of how an IPP is developed. Next slide. So the IPP, it really should be developed in a person-centered way. So that means understanding what is important to and what is important for and what those terms mean. In the new IPP, these terms will be discussed in each of the life areas that is part of a person's IPP. Important too are the things in life that make a person feel satisfied, happy, and included. It's those things that provide comfort and a sense of welcoming. In thinking about important too, it helps to think about relationships and people that the individual chooses to spend time with, status and control, culture, identity, as well as purpose and meaning. And then important for, that's not always the fun part, but it's important for includes the things in life that support the person to be healthy and safe, which can include physical health and wellness, physical and psychological safety, including proactive steps and prevention to ensure health and safety are maintained, emotional health and safety, as well as needs we have to be a valued member of our community. Important for is something that our service system is more familiar with. We put a lot of emphasis on the importance of health and safety. And that's not a bad thing, but there needs to be a balance between important to and important for. The service coordinator should be actively engaged and help people discover what is important to and important for them as unique individuals. This also applies to individuals and families who speak another language or are from other cultures. So having that understanding. Next slide. Another important part of the new IPP was first person, whether the IPP is written in first person or third person. So individuals get to decide if they want their IPP to be in first or third person. First person is using language like I, me, my, and third person uses he or his, she or her, they, their, or their first name. A first person IPP is written from the perspective of the person and can be used when they play an active role in writing the plan or a section of the plan. A third person IPP is still reflective of their input into the plan, but is written from the perspective of the author of the document. This should be a planning team discussion on how the IPP should be written. Some key things to remember are the IPP should be self-directed by the individual or by their family and should be involved as much as possible. The IPP may include others who the person or the family chooses and identify the person's strengths, goals, preferences, needs, and desired outcomes. The IPP supports people with identifying and accessing paid and unpaid services to meet their identified needs and desires. And it supports the person in making choices about their life and the supports needed to live it well. Next slide. So what is the standardized IPP? And again, we'll be putting some links to these documents as we're going through. So I'm going to describe what the new IPP format includes and what you can expect to see in the standardized IPP. This format has been developed with the recommendations and input of many community partners. The IPP starts with the opportunity to provide a positive introduction to the individual. This is where the important things they want people to know about them, what people like and admire about them, and what they are most proud of in their life. The next section, how this plan was developed, records where a meeting happened, the way an individual chose to participate in the plan, and who else helped with the IPP. This is about the planning meeting. Where did the meeting take place? Who was at the meeting? How did everyone participate? In planning for the IPP meeting, it is important to consider the preferences and needs of the individual and their circle of support. IPP meetings should be conducted in a place and at a time that is comfortable for the individual. The IPP meeting should be an opportunity for the individual to decide who provides input into their plan and what type of information is provided. You know, for young children or individuals who may have difficulty sitting through a long meeting, how the planning team captured the wants, needs, and preferences should be indicated here. A vision for the future identifies what short and long-term vision a person or family has. So this is where you'd share information about your short and long-term goals. Short-term meaning something that they want to happen soon, like in a year or less time, and long-term meaning something in the future, like 2 years or longer. This section offers an opportunity to lift the voices of the individual and their circle of support in sharing their short and long-term goals. This section might focus on one area of an individual's life where they want to see changes or have goals. It may also include objectives for those individuals whose caregivers are aging and how to plan for the future with regards to that. The next part of the IPP focuses on communication. And communication is a critical piece of all our lives and absolutely critical and a required piece included in the IPP. People want to be understood. So this is where they would share how they like to communicate. What is the best way to communicate with them? What do others need to know to communicate with them? Do they have supports or devices that are needed to communicate? How do they show they understand? Think about what other important information they want to share related to how they communicate. The conversation will likely involve others in the individual's support network. It's often the people closest to the individual that know what a certain look or tone of voice means that will help others understand. The next section is related to decision making. And this section of the IPP offers flexibility in recording life areas that a person has support in making decisions and who they receive support from. What decisions does a person make for themselves? For parents, what decisions do you make for your child? What decisions does your child make? Will your child need an advocate in the future? Is there anyone else involved in decision making? Could they benefit from support from others in making decisions? Could they make informed decisions on their own? Could they benefit from supported decision making? help from others regarding options and the impact of choices. So very important section related to decision making. Next is life areas, and this is a flexible section of the IPP that talks about a person's goals and how they would like to meet those goals. And I'll go into more detail in the next few slides about life areas. And then the final section of the standardized IPP is emergency planning. And here, with emergency planning, everyone may experience an emergency in their life, but having a plan in place will help the people around the individual to know what to do. Is there an emergency plan? What are the steps needed to keep the person healthy and safe during an emergency? Who should be contacted where there is an emergency? And what important things do people need to know and do to support the person during an emergency? The purpose of this section of the IPP is to describe the risk in an individual's life that may lead to an emergency, and that the individual and planning team agrees a specific emergency plan is appropriate. The section also describes what the emergency plan entails, including information about specific steps in an emergency or examples if beneficial to that individual. In this section, there's 3 prompts. What is the emergency preparedness plan for the individual? Who should be contacted in case of an emergency? And important things to know and do to support the person in an emergency. So let's go ahead and move to the next slide, and we'll start about life areas. So what are life areas? Life areas are also a very important part of the new IPP. Life areas are used as a way to talk about goals and the outcomes and services that an individual would like to highlight in IPP. Life areas may be selected based off a person's preferences, outcomes, services, and supports that are in place. Individuals will need to choose at least one life area to include in the IPP and should select life areas that support the outcomes desired and the services that the person is receiving or is seeking to receive. Funded services need to be tied to a life area. And lastly, each life area has 4 prompting questions. What is currently happening? What is important to the individual? What is important for the individual? And what needs to be done to meet that goal? Next slide. So here you'll see the 12 life areas that individuals may choose to include in their IPP. These 12 areas, a lot of thought were put into them to be flexible enough. So, you have things like choice and advocacy, employment, healthcare, relationships, transportation. As you can see, there are many different options and areas that an individual can focus on and create goals for. The IPP offers flexibility to use whatever life area fits best within the desired goal and the services needed to meet those goals. The question has come up throughout various times that we've presented on this on why there isn't an other category, but these categories were developed to be broad enough to cover different goals and outcomes. An example would be community participation, which may be a life area or a desired outcome for a person seeking a social recreation service. While for someone else, the social recreation service fits more appropriately with building and developing relationships with that life area. So, there's flexibility and it should be based on each individual. Next slide. So One of the last things that you'll do as part of the IPP is review and complete the agreement and signature page. This form is part of the IPP, but it's distinct from the person-centered part of the IPP and must be completed as part of the IPP meeting or process. Community members and advocates strongly express that they did not want to have the information that's included in the agreement form be embedded as part of the person-centered IPP. The IPP should be about the person and not the statutory requirements and service amounts authorized. You know, a lot of the more statutory requirements. The agreement and signature form will include administrative information. So it'll have a section on services and supports. This is where the agreed upon services would be captured. There is a space for regional center funded services as well as services funded by generic agencies. Some outcomes may have multiple services listed. An example of a desired outcome and related services could be an individual who wants to stay healthy and active. The services and supports can be a combination of support from the regional center through, say, an independent living service and a generic resource, such as in-home supportive services or their medical plan, insurance plan. Another section in the agreement form is agreement on services. This section is used to document if the individual or parent legal representative agrees with services and supports. There are two options to choose from: agreement on all services or disagreement or denial on services. You know, there's as part of that, there's additional requests that could be linked to which item is chosen. And if there is a disagreement or denial on services, if that's selected, then individuals and families have more options which are identified in the form. One could be selecting to have another IPP meeting date within 15 days or later, to have a discussion on the services that are still outstanding or where there still isn't a decision, or they can request a notice of action in their preferred language and in the format that they choose, whether it's via email or mail. Another section in the document is exceptions to settings requirements. So this is specifically about if any modification to any home and community-based services setting requirement is necessary, it would be indicated here, showing the team's agreement. The team will also write down which section of the IPP describes the modifications. There's also an acknowledgements section, and this section of the agreement form verifies that the service coordinator has provided all required information to the individual and their family, if applicable, at the time of the IPP meeting. This includes getting a copy of all the services and supports that the individual received the previous year, talking about any needs the individual has right now or in the future, the date of the next IPP meeting, how the individual would like to receive a copy of their IPP, and also discussion on a variety of topics that are required in statute to be discussed, including the service coordinator talking about self-direction, how to file a complaint, how to appeal a decision, how to get a job, you know, that's related to the employment first policy, how to register to vote, discussion about a transportation access plan, and finally, discussion about a caregiver succession plan. If, you know, as part of planning, if something were to happen to the current caregiver. Some of these topics will not be applicable to individuals who are under the age of 18, obviously. There's an additional notes section. This is just an open space to capture any additional information related to follow-up activities. or any other information that would be important to memorialize, either at the request of the individual or family. And then there's a signature page, and the signature from the individual, parent, or legal representative is necessary for services to begin. The individual or legal guardian will likely choose to sign after they, receive the comprehensive IPP document. Signatures can be captured either on paper or electronically, and there is enough space for as many signatures as needed can be added. Lastly, in the signature and agreement form, there's an optional survey. And an IPP survey was included as part of the development of the standardized IPP. This is a voluntary and anonymous survey that can be completed by the individual or family after the IPP meeting. There's a QR code that will be shared during the meeting. There's also a phone number and email address to contact the Department of Developmental Services directly for more information, or to receive a copy of the survey in the mail if that's somebody's preference. I'm going to go into more depth on the survey on the next few slides. So the IPP survey, the new IPP survey is designed to measure how well the updated IPP process is working for individuals and families. The focus is on evaluating satisfaction with the IPP meeting, whether participants felt the process was person-centered, and whether the meeting reflected best practices in planning. The goal is to gather feedback on 3 core areas: the overall experience, the implementation of the new IPP process, and the use of person-centered practices at the meeting. This survey aims to ensure that the new IPP process meets the needs and expectations of the people it serves and supports continuous improvement. Next slide. So here are the questions that are currently in the survey. The first is essentially identifying which regional center the individual or family member is enrolled in. This is obviously to see which RC the individual served, took the IPP from. Did your service coordinator listen to what's important to you and use the input to help create a person-centered plan? Were you satisfied with the available service providers to choose from? Did the regional center talk to you about self-direction and traditional service options? For each of these questions, there's a drop-down option, allowing the person completing the survey to choose the phrase that best describes the information the regional center provided. This is about the information. Was the information provided easy to understand? And then each drop-down is a different choice. Was it easy to know? It was very difficult to understand. So it gives the person completing the survey a choice that describes how they felt their experience went. And then finally, did the service coordinator treat you with respect during your IPP meeting? So again, with the survey, anonymous survey, the responses come directly to the department. And this helps us with regards to getting data on, is there things that we're seeing certain trends in with regards to the responses. Next slide, please. All right, the next few slides, now that we talked through the IPP, the format of the IPP, I want to go over a guide that we developed called Your Plan and the main sections in that guide. These guides were developed with input from self-advocates, community members as a tool for individuals and families to know what to expect with the new IPP and plan for that IPP meeting. Next slide. So what you see here is the cover page of Your Plan. And before I go over, the sections of it, you might be asking, well, what exactly is your plan? So as I indicated before, the Your Plan Guide explains the new format and describes what a person-centered IPP is. Just a quick side note, translations of Your Plan and the new IPP template are available in at least 10 different languages, and includes Spanish, traditional and simplified Chinese, Vietnamese, and many other languages. The other important consideration in putting together Your Plan was that it was written in plain language, to make it easier to understand. Your Plan can help individuals identify their preferences, strengths, and goals. In the Your Plan Guide, they'll find an opportunity to learn about person-centered planning. They'll have tips for before, during, and after the planning team meeting. There's also a workbook called About You within Your Plan that includes questions to help you start thinking about the important areas in your life, and space for you to write down your answers to those questions. Your Plan is an optional guide that can be used. It's not required, but we highly encourage it. You can read and fill out its pages and ask people for help in completing it, for those individuals that want to do it themselves. You can take Your Plan to the IPP meeting, and this can help make sure that the individual or family covers all the areas of their life that are important to them. Next slide. So what's inside? This is one of the first pages of the guide, and it gives an overview of what is to come, and also the sections that we'll briefly take a look at. We'll take a look at each of these sections briefly, including building your IPP, your individual plan, before your planning meeting, during your planning meeting, and after your planning meeting. Next slide. So this will be the first section you'll see in Your Plan. It's about building your individual program plan. Next slide. And here, this is the first page of that first section in building your individual program plan. And this particular page breaks down what the individual will encounter in the plan, and it explains everything we have talked about up until this point. This page essentially provides a broad overview of what the guide is about and what they can expect to do in this first section, which is focused on building a strong self-assessment. You'll note on this page, on this specific page, and throughout the guide, that there are areas where the individual and family can enter more information. So in this particular page, you'll see at the bottom, the person can enter their name. This workbook is about, but throughout the guide, there's different worksheets to help, get the individual and family thinking about their IPP. Next slide. So another important piece is, planning before your IPP meeting. And here you'll see the cover page for part 2, before your planning meeting. This section is exactly what it says, which is things to consider and plan for before someone has their individual program plan meeting. Next slide. So this is one of the first pages of part 2, and it informs the individual of the different things to consider, to think about when brainstorming some ideas for what they need to be successful. This page encourages individuals to think about the places, where they do things. It could be activities of daily living, like shaving in the bathroom or going to the store. The different items that they use to reinforce learning, such as an example would be using real money when budgeting. thinking about the different things that they do on their own. And it also encourages them to think about the overall services and supports they may need by thinking about what their goals are. Next slide. So making decisions at your meeting, this page is also part of part 2. And this page reviews with the individual different things to consider when making decisions at their meeting. It prompts them to consider things they want to learn, what kind of work they want to do, where they want to live, how they want to spend their money. It also asks them to consider who it is that they want to attend the meeting with them, who's going to be part of that planning team. This part of the guide encourages the individuals to ask themselves questions that will better prepare them in creating a plan. Next slide. So part 3 is during your planning meeting, and this is the cover sheet for that for part 3. Next slide. And here are some things to do at the meeting. This is one of the pages from part 3. This provides an overview of what individuals should do during the meeting. Some of the suggestions include consider bringing this workbook, this guide that they have completed. Be positive, take notes, and be willing to ask for help when it's needed. Next slide, please. And then part 4 is after your planning meeting. So this is the cover page for part 4. Next slide. And, here there are some pages in the guide that help the individuals reflect on their experience of making the plan of the IPP. One of those pages is the one you're looking at on the screen right now. It includes numerous yes or no questions, and it helps the individual determine if they thought the meeting went well. It also gives them free space to write things down that they thought went really well, but also a space for them to write about things that they think could have been better. And as you'll see, these are all things that are check boxes and additional areas for writing text. Next slide. As part of this section, there's also a 6-month checkup. This is another page that is included in part 4, but this page is focused on reflecting after some time has passed from the IPP meeting. One consideration could be after 6 months, we encourage the individual to return to this page and ask themselves if they feel like they're meeting their goals. Are they doing what they want to do? Do they feel like they're seeing the people in their life that they want to see? There's also space here to write down things that they could be doing better. Next slide. So that concludes the different parts of the guide. I now want to share with you some other resources we have available. And if I didn't mention it before, for the Your Plan, initially when the standardized IPP had been developed and Your Plan had been developed, it was just Your Plan. And then we quickly figured out, no, we need to have guides for different age groups. So Your Plan is for adults. There's also your child's plan and your adolescent plan available on the website too. And it takes into consideration those age groups and, some of the things specific to being in those age groups. Next slide. So here we have, these resources are, this is like a summary of all the resources, including the guides, which are interactive tools to think about goals, strengths, and successes. We just reviewed the different parts of Your Plan, but there are also the other 2 guides that I mentioned. Your Child's Plan which is for families with children ages 3 to 13, and your youth's plan, which is for young adults ages 14 through 22 and their families. And then we currently have these guides available in 12 languages. The purposes of these guides is the same as your plan, to provide a tool to help individuals and families prepare for the IPP meeting. There are also trainings that the department has provided to different groups, which includes we have a internal consumer advisory committee now known as the Lived Experience group. We've also done trainings for the Family Resource Center network throughout California, obviously with regional centers and other CBOs and community groups. There's also a comprehensive IPP guide for the regional centers. So as part of rolling out the new IPP, we put together a guide for regional centers to train their service coordinators and as a reference and resource. And in this guide, there's a very helpful appendix section, which includes all the citations to statute, both federal and state. You'll also see on our website that there is a video series which includes serve as additional ways to learn about person-centered practices and the IPP. One is an interview style series about using person-centered practices to develop an IPP. These videos support an individual or family to start thinking about life goals, desires, and supports. And then there's also an animated series that explains the IPP and what needs to be done to prepare. These guides and the new IPP format obviously have really changed the IPP process. We're now into the 10th month of implementation. The whole push behind it was to have the person, the individual, at the forefront of the discussion. These videos and guides are helping set the stage that this new IPP meeting is going to be different than meetings in the past. Next slide. So here is a summary of all the resources we just reviewed on the last few slides and more we didn't cover. These are all available on the department's website, and we'll also include the link for this. We put together frequently asked questions based on the rollout and the continuous feedback that we get. So those are really helpful as well. Next slide. And here you'll see the cover art for each of the different guides, your plan, your child's plan, and your youth's plan for reference purposes. Next slide. Thank you. So this concludes the presentation part. Really, again, appreciate the opportunity to present. Please take note of that IPP support at dds.ca.gov. That's our go-to email address for any questions or issues related to the IPP. And again, really appreciate the opportunity to speak here today. So thank you.
Well, thank you so much, Ernie. We appreciate the wonderful resources. And again, all the links and the materials will be coming to everyone here in the email that's going to go out after the conference. So don't worry, you will get them all. And, personally, but also for everyone here, I think we're very grateful of the positive direction, the person-centered direction that DDS has moving into for the IPPs. So we're grateful for that. As I said, myself, my daughter went through hers, and it was wonderful, very empowering for her. She filled out as much as she could of the Your Plan, brought it to the IPP, and spoke for the first time at her IPP meeting. So it was wonderful. So if I can direct some questions to you, there's some confusion of several questions about if we're in the self-determination program, if we're not in the self-determination program, you have that person-centered plan that you do before SDP. It's very helpful. How is this differ? How is it the same? If you could just address probably, 7 questions with your answer, that would be great.
Yeah, no, Alyssa, that question came up early on in development. The IPP is the IPP. The IPP is a driver of, services. You could still have a person-centered plan, and have your IPP. So the IPP wasn't the changes to the IPP that were made weren't intended to take away a person-centered plan. Those can still be completed. It just, like you indicated, transformed the IPP that's in statute to be more person-centered.
Right. Um, Also, some questions about we just had our IPP and none of this was mentioned. We're going to have our IPP tomorrow. Should we stop and reschedule and do this again? So maybe just explain 21 different regional centers, 21 different ways of doing things, and maybe just put people's alleviate some some stress.
Yeah, no, definitely. And, that as part of implementation of this over the last 10 months, hearing different stories, hearing, hey, the IPP that I was given looks different than the standardized. And those are things we follow up on. The law now says the regional centers have to use a standardized IPP. So it has to follow that format. So if you've had an IPP meeting and it didn't follow this format, or you weren't provided information about the survey, we, obviously first would encourage you to talk to the service coordinator or their manager, but you could also reach out to the department. And that's why I really wanted to highlight that dedicated email address, because we do get emails there on a variety of, not just negative. We hear some positive feedback as well, but we do follow up on issues. If something wasn't implemented the way it was meant to, or somebody wasn't given information about the survey. So we want to hear about that.
Yeah, and there are some questions about what to do if we have a complaint. Nobody said what to do if we want to say things are going great, but that you could also communicate with that. So again, with the resources and the links that will come to you, you'll be able to do that, and that answers a couple of questions as well. Um, how about this one? A couple of questions about what if your young adult is conserved? Um, certainly someone's asking, can they still participate? And of course, yes, all the better. My daughter's conserved, she participated, very empowering. But what about that fine line, for those of us who may have their young adults or adults conserved, but we have that supported decision mindset, but we have the conservatorship safety net, and how to approach that to a service coordinator who may have more of a supported decision-making mindset. Am I kind of, I don't know, a tough line to walk,
Yeah, yeah. No, obviously, a service coordinator should know if a person's conserved, and and respect the conservatorship's feedback into the process. But like you were saying, still approach it with developing the IPP based on the person, right? And there's just a few more factors that have to be considered. Um, and but I don't think that someone being conserved necessarily needs to take away from developing the IPP in a person-centered way that really highlights the individual's strengths. What the individual really likes, what's important to the individual, what's important for the individual. But yeah, to answer your question, there are individuals conserved out there that have IPPs, and the service coordinator should be aware of that. That they have a conservator and that person's voice is as important.
Yeah, indeed. And um, so we spent a lot of time preparing, my daughter has a person-centered plan, preparing going into the IPP meeting. We spent a bunch of time. So people are asking, how much time should we allot for this IPP meeting? Because it's quite a different form and quite a different lot of questions. And if you have all those life areas filled out, you're going to take a lot of time. So what would you suggest?
Yeah. Um, Again, with rollout of a new format, I've been hearing different things. I've also been hearing from regional centers that, these are taking up to 2 hours. I think as people get more used to it, you start having them completed. I think that will make service coordinators, they'll familiarize themselves with the tool, how to approach it. I don't think there'll be as long meetings as perhaps this initial one.
Mm,
But I think as part of that, really looking at the guides, the Your Plan guides, um, and going into the meeting with, some more, like I said, you don't have to do it, but the idea behind them was to prompt questions
mhm.
that you can ask during the IPP to the service coordinator or say, hey, I really want to focus on this. So, really encouraging the use of the guides as much as possible. And we realize this first year, you have a lot of service coordinators going through training, learning a different way. I think as we continue to move forward, that they'll become better at it and more knowledgeable about it.
Oh, absolutely. And I think everybody has to have compassion for when there's change. And our service coordinators, they are overworked. They carry huge, huge loads. It was the same thing when SDP came out. It's like, my service coordinator doesn't know anything about SDP. Well, give them just a little bit of time, so yeah.
Yeah, no, that's a good point, Alyssa. And, I think in one of the slides I had talked about person-centered planning, and person-centered planning has been around a long time. Um, I would say within the last 10 years, there's really been a focus on regional centers having certified person-centered trainers on staff
Mm,
who then train the service coordinators.
mm,
And we've that's kind of has set the foundation for us to be able to build this person-centered IPP
okay.
because the skills are out there now. And if it's a new SC that starts tomorrow, okay, the regional center has a person-centered trainer that will eventually train that person in person-centered skills,
That,
person-centered thinking.
that's wonderful. I didn't know that. Another piece that I quite liked when I was going through the IPP form, the sample form, which, by the way, you can also find sample forms on the DDS website. It's a very comprehensive site. Visit it, explore it. You don't have to do it all at once. Take your time because there's a lot of good information there. The emergency plan, that was really a very nice addition. And somebody's just wondering, what if the parents are unable to care for their adult child and there's no residential option? What happens in that case? Did they end up in a hospital? That's really not an option. Can you just speak to that a little bit?
Yeah, no, that's like you said, whether it's the emergency plan or really speaking about caregiver succession, that became part of statute that individuals ages, I believe, 22 and over, you have to talk about succession planning with the family. So yeah, if there's a situation that's coming up, an emergent situation that a family may no longer be able to take care of their adult individual, there's options. There's various options. There's not just licensed residential. They could potentially receive supports in supported living. There's family home agencies, which are, like foster care for adults. Where the individual lives with a family, no more than two individuals in the home. There's other options, and the service coordinator should be able to speak to, what those options are, or tap resources within the regional center to get more information about that.
Okay. And let's see. So a lot of people out there have gone through that with their students for the IPP, and some people sign on the IPP on the dotted line before they leave. Some people take it home and review it. They call their parent training information centers or family empowerment centers, and they ask them for help reviewing. Is that the same thing with this IPP? Do they need to sign right on the dotted line when they're done? Will they get it later? How long should they expect to wait between, having the meeting and getting the signed paperwork? And again, 21 different regional centers, 21 different ways of doing things, but just your opinion, your sense.
Right. Typically, there's nothing in statute specifically outlining a timeline for the IPP, but what is in statute, speaks to if somebody requests their IPP to be translated, that should be provided within 45 days. So, I would say that if you haven't received feedback from the service coordinator within 45 to 60 days, to follow up with the regional center, and ask about the status. One of the things that has to be done at the IPP meeting is that while the IPP may not be written and completed, they have to leave a list of agreed upon services. So making sure that that is still being provided. But with regards to when you could expect to actually receive the IPP document, while nothing in statute, we typically say, 45 days to 2 months. And then if haven't received any feedback to follow up on that.
Okay, well, we thank you so much, Ernie, for taking your time today and coming to visit with us.
No, thank you, Alyssa. Thank you for the opportunity.
Thank you.